I think for many years, the perception that plastic surgeons are the only cosmetic surgeons. And I think for the most part, they're the majority of surgeons doing cosmetic surgery, but they're not the only surgeons doing cosmetic surgery. And my personal opinion is that fellowship training separates everyone. When you do a residency, you're learning the basics and all the different specialties within that realm of medicine. So the residency is usually 5 to 6 years when you're a surgeon. And during that time, you do 3-month rotations on each different specialties. And then they become a specialist, they do a fellowship afterwards that usually lasts 1 to 2 years. And it's that year that really gives you the expertise in a subspecialty in a field. So hand surgeons that are trained as orthopedic surgeons primarily probably have a little more experience than a plastic surgeon with hand surgery fellowship training. But I would say that I've seen amazing plastic surgeons who've become hand surgeons because they did a great fellowship and they have a natural skill for that. Cosmetic surgery is very similar. When you look at and you dissect plastic surgery programs around the country, that their residency falls short when it comes to cosmetic surgery exposure. And that's because it's managed by the Accreditation Council for Graduate Medical Education. We call it the ACGME. It's a body that oversees most of the accredited fellowships that are supervised by the government. What that means is, unfortunately, that most surgeries that we do in every specialty are not elective. And most of them only have exposure to cosmetic procedures in their last year of training. So when you do an inquiry of those exact people, 50+% of the residents feel like they have inadequate cosmetic surgery exposure in their residency. So most people, I would say, agree that a cosmetic surgery fellowship really creates an expertise.